Good afternoon, live from Toronto on the GBKM network. This is the Chat Up Show, the show where we catch you up with the chat up of our weekly headlines. I'm your host, Elizabeth Aloidi, and I hope that you are ready to chat it up with me today. Now, as always, you know you can keep up with the GBKM network in various ways. You can continue to listen and watch live 24/7 at www.gbkm.tv or www.gbkm.fm, where you can also catch up on any past shows you may have missed, check out our upcoming show schedule, learn a little more about our on-air personalities right here at the network, check out our breaking news, and so much more. Also, make sure you download our free app. Now, the best thing about the app is you get all the same features as on our web station. You get to listen and watch live 24/7, like, share, comment, all of that good stuff. Past shows, upcoming shows, you name it, you'll stay up to date with us at GBKM. But you also get notified every time we go live on our app. So make sure you download our free app. Just search GBKM. It's available for all iOS and Android devices. And you'll be able to take us on the go with you. So whether you are TTCing, you're on public transportation, you are driving, commuting, what have you, you can take us on the go and listen no matter where you are, whether you're in the GTA, across Canada, across the globe, you can take GBKM with you and stay up to date always, 24/7. You can also continue to watch us on Facebook and YouTube at GBKM Network, where we also go live, where you can also like, share, comment, and subscribe, join in the conversation, become a part of our community right here at GBKM. And to keep the community growing, you can also follow us on Instagram and Twitter at GBKM Network, where we will give you all the updates on what's going on right here at the network. Now, the topic, I'm sure, has rang some alarms. You're probably thinking, year 3 of the pandemic, what's next? What could possibly be next, What else could our government be doing or implementing? What new update that we haven't heard of before could there possibly be? What else can this pandemic do? Now, these are very valid questions. They're all questions that are in the back of our mind, the forefront of our mind, just in our minds constantly over these past 2.5 years, 2 and so years, almost 3 years now, that we've been dealing and handling, let's say, this pandemic. It hasn't been such an easy road. There's a lot that we've had to overcome. There's a lot that we've had to understand about ourselves, about our society, about our community, how we're able to overcome this pandemic. Now, this new update, however, isn't all doom and gloom. Don't worry, I won't do that to you guys. You guys know I love to keep things happy, positive, hopeful. I don't like to bring y'all the bad news like that, okay? I don't like to give you bad news only and not leave you with something, at least something sweet to taste in your mouth at the end, okay? So do not worry, it's not all doom and gloom. Some of these updates and some of these new implementations and new procedures and what have you, and new discussions that are happening with our health officials and our elected officials as well, is to help us move forward and so we can come out the other side of this pandemic less scathed than we have been the last few years. There is some positivity and silver linings on the horizon. Now, just for some background knowledge, just to see where we're at in terms of hospitalization for COVID cases, in our province, Ontario, reported Tuesday that another 296 people were admitted to hospital with COVID-19, which is raising the total of people in care to 4,183. Now, I know, a little gloomy, because this is technically a pandemic high. And there are also 580 patients in intensive care, and an increase, which is an increase of 2 from Monday, but well within the healthcare system's capacity. So even though we're seeing the rise in a number of people who are being hospitalized and who are in beds, it's still well within the capacity that our healthcare systems can work with, and we're not putting too much of a strain on them. Because we remember, a lot of our restrictions were to help our healthcare system, so they're not completely overloaded and going overboard with taking care of COVID patients, with taking care of patients, period, like we were at the beginning of the pandemic. That is the whole point of why we've gone under lockdowns, why we've had these slow, phased in restriction lifting, lockdown phases, whatever you want to call them. That's why we've been doing what we've been doing, is to make sure that our healthcare systems aren't completely overloaded and bombarded and unable to perform what they're supposed to do, heal people and make sure people survive this virus and are able to go back home to their loved ones. And we all have to do our part. This is a community effort, as we know. Now, there were also another 37 deaths that were reported, which was mostly from last month's data. So as I mentioned, of course, this isn't the news that we want to hear. It's not necessarily the happy-go-lucky news that we want. It's never good when we reach a pandemic high with anything, whether it's cases, number of deaths, number of people in hospital beds. We don't want to have to keep reaching these highs. We don't want to have to keep breaking these records. The only kind of records we want to break is seeing those numbers decrease, right? We know just how much of an impact the COVID has made on all of our lives. And we're still understanding the long-term effects of COVID. I mean, it's only recently now that we're seeing people who had quote unquote mild cases of COVID earlier in the pandemic who are now dealing with consequences of having those quote unquote mild cases, i.e. they've lost their sense of smell or taste, or anything they smell or taste doesn't taste like what it is. It tastes either like burnt wood or hot garbage. It's not a good experience. And these are things that we're slowly learning as the years go by. And that doesn't sound positive. I know. I hear it as I say it. But stay with me here. We're going to get to the positivity very soon. We just got to work our way through all the other parts of it, right? Now, of course, we cannot ignore, as I mentioned, how much this pandemic has had an impact on our daily lives, just from regular work life, travel, school, just home life in general, how we socialize and interact, how we develop our connections with our communities. It's made a huge impact. We aren't able to do certain things. People aren't able to see their loved ones. People are we're unfortunately dying alone. And it's so sad to see that, and it's sad to say it, but this is the reality of what the pandemic is. So if you're still one of those people who was like, oh, I mean, I'm lucky I haven't gotten COVID and I'm still out here socializing, just take into account what that means, not just for yourself, but your community as well. What, we are exposing ourselves to, what the potential could be. Even with these mild cases, there could be some long-term effects that we still do not understand until they are tested in the long term. It may take a few years before we fully understand the actual impact COVID-19 has had on our lives, on our health in general. And it doesn't make things easier when it feels like our elected officials aren't giving us the answers we're seeking. I mean, so many people have so many questions still to this day about how our governments have handled the pandemic, whether it's federal or even just provincial governments, how they've handled it, how they are planning to continue handling it, what lockdown restrictions, what steps they've put into motion to ensure that people are staying safe and healthy and ensuring the safety of our entire community and society here. And it, of course, doesn't help when there's a blizzard as well on top of that. It doesn't make things easier, If you are somewhere that didn't have to deal with the blizzard weather this week, I am very jealous of you, because that is another added thing that we have to think about too. But this pandemic has taken a lot out of us, and I think that we need to take that into account and realize just what that means for our society and how we move forward. We have to be somewhat realistic with the way we can move on. A lot of folks we've kind of ditched the idea of going back to normal, going back to the normal we knew before the pandemic. That life, honestly, we're probably gonna have to just mourn and grieve that old life, because that's not the life we're living right now. And it's probably not gonna be the same life we're gonna live even after this pandemic. But we are gonna get into what the silver lining is right now, the silver lining that we're getting from health officials and our government officials as well, the hope for the future and how we are going to move past this pandemic into a new normal, how we're going to move through these new restrictions that were put in place earlier this month as well. So we're going to dive right into that. I hope that you are ready to chat it up with me today. We're going to get into year 3 of the pandemic and what's next, what we can expect. So Canada's Chief Public Health Officer, Dr. Theresa Tam, says the COVID-19 pandemic may end with an endemic form of the virus, which basically means it doesn't necessarily fully 100% go away, but we're able to manage it and deal with it, right? So Tam had told members of the House of Commons Health Committee, quote, last week, quote, I think many experts believe that so-called herd immunity may not be achievable with this virus because it undergoes constant evolution. We see that with so many different variants. Now we're, the IHU variant that was spotted in France not long ago. We're seeing this virus constantly mutates to create different variants, and it feels like we're still playing catch up with the mutation process of this virus, right? She also went on to go and say, so what you're looking at is this endemic state where people will get reinfected over time as immunity wanes. It will also be determined by the appearance of variants that may invade the immune system as well. So I think that the reality is going to be more like an endemic virus. Basically that this is something that might end up being like the flu as opposed to a virus or disease that is completely eradicated like the smallpox. I'll get into that a little bit later. Now, when asked by NDP health critic Don Davies what criteria the federal government required to officially make that determination that this pandemic will probably move into an endemic stage of that virus, that we won't completely get rid of it, Tam said that an assessment would have to be made at the international level, meaning that it's not just our government, our federal government, that's going to make that analysis, that it's the whole globe essentially that's going to come to a consensus as to how this pandemic will evolve and whether it will reach the endemic stage. Now, let's look at a somewhat international level of this discussion. It's not that international because it's our lovely, friendly neighbors down south. When asked about this pandemic becoming an endemic, Dr. Anthony Fauci, who is U.S. Chief Medical Advisor, said, we still don't know, that it's still early stages, we're still unsure. Though our Chief Health Officer is saying that this is potentially where it could go, Dr. Fauci is saying that we're still unsure as to whether it will get to this stage. That he also went on to describe the 5 phases that he's been using to describe this pandemic, that is probably which is probably the phases that we're going to see as time progresses. So this is based on other diseases that have essentially been eradicated by vaccines, or that have been controlled, rather, let me say, by vaccines and immunity, if you will. So the first phase, he says, is the truly pandemic phase, where the whole world is really negatively impacted, which is essentially the phase that we've been in for 3 years now. Yes, we're still in the first phase, according to Dr. Fauci. Now, the second phase is the declaration of the pandemic, which, I mean, we kind of already declared that. Or the deceleration of the pandemic. So we kind of see that when we start seeing cases dip. And, you know, in the summertime, we start thinking, okay, this is when it's going to start slowing down. We're going to start, you know, relieving some of the restrictions that we put in place. Maybe we're going to start easing out of the lockdown phases that we've been in for however many months we were in it last year. Those type of things. But, however, we're not completely in the second phase, because we still see the wave of cases where there's the dip and then there's the incline again, like we're seeing now. Now, the third and fourth phase are the elimination and eradication phase. He goes on to explain that if you look at the history of infectious diseases, we've actually only been able to completely eradicate from the face of the earth one infectious disease in man, and that is smallpox. That other infectious diseases, or just diseases in general that we've used vaccines to kind of fight, haven't completely 100% been eradicated, because there are some areas of the world that are still dealing with it. A good example of this is polio, that it was eliminated in certain areas, but it wasn't completely eradicated across the globe, that it's still an issue in some parts of the world. Now, Fauci says that that's probably not going to happen with this particular virus, hence the conversation of it being an endemic virus, because the chances of us completely eradicating it, I mean, we know from our past research that coronavirus in itself, the name isn't new. It's not a new concept. It's that COVID-19 is the newest coronavirus that we're dealing with. Like, this is the novel coronavirus, and now we're dealing with the mutations of this COVID-19 with the different variants, right? So now the next step of that is elimination. Elimination means when you get rid of it in your own country, as I mentioned, but it's somewhere not in your country, somewhere else. It's still there, but maybe not necessarily in the country that you reside in. For example, polio, which I mentioned, it's been eliminated in a lot of developing nations across the globe, but not all of them. So then what's the next one up the ladder after that? You know, you think that elimination is it, that's done. Okay, you've eliminated it, you should be fine, right? No, because it's eliminated, not completely eradicated. You still have to control it. So that's the fifth phase of the pandemic phases, according to Dr. Fauci, is control, which means you have it present, but it is present at a level that does not disrupt society, i.e. the flu. I mean, yes, people do die from the flu every single year, but it's not to a level where we're locking down during flu season. You know what I mean? Like, it's not to a point where it's completely disrupting travel. It's completely disrupting how we work. It's completely disrupting how we socialize. It's completely disrupting how we just live our lives on a daily basis. We're not in the control phase at all. We want to get to a stage where we're at the control phase where it doesn't completely interfere with how we live life, that it may be there and we will know how to handle it, but it's not 100% gone. It's just not as bad as it is now. Like, for example, the cold weather, as I mentioned, so that's what most people see when they talk about endemicity, making it being an endemic, is where it's integrated into the broad range of infectious diseases that we experience, but it's not completely taking over our life. For example, the cold weather, upper respiratory infections, the parainfluenza, the respiratory syncytial viruses, the rhinoviruses, people have strep throat, flu, those things, colds, you get those sicknesses, you get sick, and then you heal yourself and you're fine, you're good to go back to work. It's not like you're necessarily forced to isolate or forced to take time off work or forced to go get a test to prove that you are actually sick with this certain illness. Like, that's where we're hoping that we can get to with COVID-19. So basically, we just want to get to a level that it doesn't disrupt our society to the level that it is now. And he basically says that basically answers the question of whether he believes that we can go from pandemic to endemic, is that is essentially the goal with COVID-19, that it's unrealistic to want it completely eradicated, but reaching this endemicity will probably help us be able to control the number of cases and control how it impacts our life, and it won't completely take over society. Now, his official definition of what endemicity would mean is a, quote, non-disruptive presence without elimination. So not being completely eliminated, but we can still move around. You can still go home for Christmas. You can still travel whenever you want to. Like, if you want to plan a random trip that like off the drop of a dime and say, I'm going to go to Paris tomorrow, yes. And you don't have to think about PCR tests, quarantining facilities, quarantining isolation days. None of that. You don't have to calculate how much you're going to have to spend on the different tests. You don't have to calculate how many hours you have to make sure the tests are viable for when you're traveling anymore. That is where we want to get to with the pandemic. Now, a lot of people are probably thinking, how are we going to get there? How are we going to get to that point? Valid questions. So our federal health minister, Jean-Yves Duclos, also faced questions after Canada's healthcare capacity and level of preparedness for this Omicron-fueled rise in cases, as hospitals across the country strain under record levels of COVID-19 infections. We know that we want to make sure that our healthcare systems are not completely overwhelmed and flooded with COVID patients. And we know we want to get to a point where, this virus becomes an endemic, not a pandemic, right? Not continuing in a pandemic. Unfortunately, I wish I could say that Mr. Duclos gave us a proper answer to this question, and I wish I could say that a lot of our health officials gave us, or even elected officials gave us proper answers to some of these questions. These are questions we've had on our mind for so long. How are we actively going to get there? I mean, one proposal that our governments had was increasing rapid testing. And one of the initiatives that were put in place, even here in Ontario over the holidays, was providing the free rapid test kits. But we know that rapid testing isn't the best option, that regardless of whether you get a positive or a negative test, chances are you're still gonna have to go get a PCR test anyway. So is a rapid test kit really the best option? Granted, it is the first step. It's the first barrier that you have to overcome. But it's not the final one. It's not the final thing. Like, it's not the final answer that you will take. Like, yes, I got a negative test and a rapid test. You still need to check on yourself. You still need to self-isolate for some time being, just to make sure that you are 100% okay, and make sure that you're not going to go on and pass it to someone under the guise of thinking that because you got a negative rapid test that you're fine. Even positive tests, they're encouraging that you go get a PCR after, because even that positive could be a false positive. So we do see our government putting things in place to try and help combat it, to try and help get ahead of the growth, if you will, or the spread of this virus. But there are still some shortcomings. Now, opposition MPs asked him questions on a range of issues that also included Canada's relatively low number of acute health care hospital beds per capita, i.e. there aren't enough beds for the bodies that need beds. Shortages of healthcare workers during the Omicron surge, mainly coming up on the tail end of the new implementation, or the new, rather, restrictions that were put in regarding vaccination policies, where people were saying that folks should be fired from their jobs as healthcare workers if they're not fully vaccinated. Okay, but now we're stuck in this rat race where it's like we need healthcare workers to help deal with the rising cases, but we are letting go of healthcare workers because they're not being vaccinated. And it's the cycle where we need this, but then we're also letting go of them because of this thing. So weighing the options of what is best. We're keeping healthcare workers on because we need them, and they are our frontline workers. They're our heroes. Remember at the beginning of the pandemic when we were clapping every night for them, when we were shouting out our heroes on the front lines? What happened then? Which is a question that our officials and MPs were asking. Why aren't healthcare workers being paid more? Why aren't there more job opportunities available for healthcare workers? What happened to the promises that were made by the government that is in power right now, our federal government, during the very speedy election that we had towards the tail end of last year, or towards the fall of last year? What happened to those promises that there was going to be more money allocated towards our healthcare services so that our healthcare workers are paid what they deserve to be paid for dealing with this pandemic, so that they have all the necessary resources, so that people aren't having to essentially play God in saving people's lives because they don't have enough beds or ventilators or just staff to take care of patients, to take care of the rising number of people with COVID cases who are being hospitalized. That there needs to be some form of accountability for our government when they're making these promises to follow through, especially when people's lives are at stake. We don't want to see more people dying. We don't want to see more people in hospital beds. We don't want to see more families ripped apart. We don't want to see any more people having to be alone and suffering and dealing with this alone. Like, we want to know that the people we've elected into power to protect us, to ensure that, we are safe as a society, as a community, are living up to their end of the bargain. Now, Stephen Ellis, a Conservative MP from Nova Scotia, essentially called out the Liberal government for its quote-unquote failure of leadership for these reasons during the pandemic, by not building enough healthcare capacity to allow provinces to avoid the restrictions imposed in recent weeks. That if we had put in place a system that would strengthen our healthcare systems, maybe we wouldn't have to have locked down for the 8 months we did last year. Maybe we wouldn't have to have the new restrictions that we have now. Maybe we won't have to stop other people's, livelihoods because we're trying to play catch up for our healthcare systems. That if we'd actually put some sort of structurally sound programs or plans into place, that we won't be where we are today. That we would have to avoid closing down restaurants, closing down schools, that we would avoid closing down gyms. He also pointed to the Liberals' promise during the 2021 federal election that they had wanted to hire another 7,500 healthcare professionals. Now, Ellis asked Duclos to say how many had been hired. Now, let me ask you what you thought the answer to that question was. There wasn't a direct answer. Duclos basically didn't directly answer and instead referred to the $63 billion he said the government had designated for healthcare during the pandemic. Okay, so then that $63 billion, tell us exactly how it was spent, what it was used for. Was it used to hire new healthcare professionals to help deal with the pandemic, to help deal with the rising number of cases, to help deal with this new variants that seem to be popping up every few months now? Now, Duclos did say that thousands, not a specific number, but thousands of healthcare workers are being paid and recruited with this money, but he did not provide any further specifics. So there wasn't really any specification as to what that money was really going for, and whether it was going towards the actual number of healthcare professionals the government had promised to hire to help deal with the pandemic across the country. Now, the NDP is also calling on the government to fast-track the immigration of healthcare workers, as well as a national strategy on human resources in healthcare. Why? I'm sure you're asking why this is important. Well, because there are a lot of those who are working in healthcare who are immigrants and who do require, certain documentation to remain working, legally speaking. And we need as many healthcare workers as we can get. There are so many doctors, nurses who have come from other countries who have immigrated to Canada. And because for whatever reason their certification does not carry over, they are now unable to work within the field that they do have the experience to work in. So now the NDP is calling on the government to say, hey, allow them the proper documentation to help, because we're saying we need help. Well, then let's use the human capital that we have to help deal with it. Why can't we do that? Again, no real direct answers. Now, when Davies, who again is the NDP health critic, asked about that strategy, Duclos said he agrees that lack of staff is a key challenge in healthcare systems across Canada. He said, quote, "We'll continue to do the right thing, which is to support the efforts of provinces and territories to train, hire, and retain those healthcare workers," end quote. Now, some folks are probably thinking, okay, but you continue to do the right thing? Were you doing the right thing to begin with? If we are still in the middle of a pandemic and we're still fighting for the rights of our healthcare systems and our healthcare workers, that we're still fighting for our healthcare workers to be paid what they're due, to not have to overwork themselves. People are working, 36-hour shifts. For what reason? Why can't we hire more people? If there are funds allocated to the healthcare system, then why are we still having these conversations? You say there's $63 billion for this very reason. Why is it that we're still asking you if you're living up to it? It should be done already, no? Now, Bloc Québécois MP Luc Thériault, pardon, sorry if I butchered that name. Now, he picked up a similar theme and was essentially echoing calls from Canada's premiers for Ottawa to increase annual federal transfers for healthcare by about $28 billion, which, when Duclos referred again to the government's pandemic spending for health, Thériault suggested he was playing politics, quote, politics on the backs of COVID patients. Now, I'm sure you watching at home are probably thinking, yes, finally we're hearing from our elected officials what we wanted to hear. We're holding the people accountable who need to be held accountable, asking the questions that need to be answered. Why is it that there's funding for this, but we're not seeing it used in the way that, we had been promised that it would be used for? Okay, then let's find some more funding that would help aid in some way for our healthcare workers in some capacity. Why not do that? Why not have some of this funding allocated towards that? Like, why not find new ways or find new strategies to help deal with the problem that we have at hand? This isn't just on a provincial level. This is across Canada. This is our federal government we're speaking about. The people are calling on our federal government to listen to the cries of, our premiers, our MPs, to listen to them, our health critics even, health officials too, to listen to them and actually take into account the questions and the worries and concerns that we all are essentially sharing. He also asked whether it would take a 6th or 7th wave of the pandemic before the government committed to structural increases in health funding. It's a little shady, like, we're not gonna lie, they're getting a little shady with it, but fair question again. Like, is it going to take another wave of the pandemic before we realize that it's important for us to actually use funding for our healthcare, to strengthen our healthcare systems across the country, to ensure that they're not, or our healthcare units across the country rather, to ensure that they're not swamped like they were during the first few waves of the pandemic, that it doesn't seem like it's a surprise again when we go through another wave of the pandemic, going through the in and outs of lockdowns and restrictions and dipping in and outs of cases and no cases and low cases and high cases, or no low deaths and high deaths, or low bodies in beds in hospitals, or no bodies in beds in hospitals. Like, we don't want to continue going through this pattern of up and down and up and down, that there needs to be something structurally put in place when it comes to the funding, that we know, okay, within this time frame, this is how much money that's going to be allocated to this service for this reason. This is how much money that's going to be allocated to this other service or to this other unit. That we understand that there's some sort of structure to it, not that we're trying to play catch up, not that we're like, oh no, the cases are rising again. What can we do? Okay, let's just scramble and try and figure it out. What's the easiest thing to do? Let's put everything back into lockdown, or let's go back into amended phases of reopening or restrictions. That we shouldn't have to keep doing this, that there needs to be something that's put in place that governments across provinces can follow and adhere to, and we can come out the other side of this pandemic. Now, Luc Berthaud, a Conservative MP from Quebec, also pressed Duclos, it just feels like everyone's pressing Duclos, on the federal government's provision of rapid testing during the Omicron wave, alleging Ottawa had been slow to respond to demands for the tests amid soaring infections. He basically asked, why wasn't the government prepared? This isn't the first month, this isn't the first week, this isn't even the first year, this isn't even the second year that we're dealing with the pandemic. Why is it taking our government so long to catch up or to be prepared for these new waves? If we've dealt with it before, why does it seem like it's coming as a surprise every time we see the cases rise? We have some level of understanding. The more people socialize, the more they're not, we don't have as many restrictions, the more we see the cases go up. And then it's the same in the cold seasons that we see cases go up, because that's the season that a lot of viruses tend to thrive. Whereas in the summer, the cases go down a little bit. Why don't we look at those patterns and maybe adjust our structures for reopening to take that into account? We can't keep doing these open for a few months and then go back into some sort of amended lockdown as if that is the way to live life. No one can make plans this way. How are we supposed to plan for a future when we can't even plan for next week? We don't even know what's going to happen next week, because we don't know if we're actually going to be moved out of our restricted lockdowns, or if we're going to, move into new phases. Now, Duclos responded that the government is planning to deliver rapid tests, about 140 million of those tests, to provinces by the end of this month, by the end of January, and noted that provincial requests for such tests have skyrocketed with Omicron. I mean, obviously, because governments are trying to do it, like provincial governments are trying to do as much as they can to deal with the pandemic, to deal with the number of cases. And if that means giving out free testing kits so that we ourselves don't have to rely on, going somewhere to get tested, that we could just do it within the comfort of our own home, to have at least a base level, even though it may mean that you have to go and get a PCR test after, or you have to go and, isolate at some point. It at least gives you some base level of understanding of how you're doing. It at least gives you some understanding so that, people who are actually sick aren't not isolating because they don't know they're sick. Now, health officials also said that there were no plans to add booster shots to Canada's definition of what constitutes a fully vaccinated person, which in most cases is when someone has received 2 doses of a vaccine accepted for travel. So then the question is, why are the boosters required then? Well, they're saying that the booster shots are required because we need boosters to continue to strengthen our immune systems against these new variants. Of course, that there is a new booster that's working, that's in the works actually right now, that's being studied and researched and developed to help with the deal with the Omicron variant specifically. That maybe that will help with how many cases we're finding of this new variant. Now, with this particular situation, Theresa Tam said reviewing that definition would come only after more Canadians had received a booster. A figure Duclos said is currently sitting at about 34%. So only 34% of Canadians have received their booster shot. So once we start seeing more Canadians receive a booster shot, then we might actually move into, you will only be considered fully vaccinated if you have 3 or 4 doses of the vaccinations. And then that would also that will also affect how you travel. That may also affect the places that you have to show proof of vaccination before gyms and restaurants close down, those types of places. Now, it does feel a little discouraging when, MPs and officials are asking those who essentially should have all the answers, are asking them these questions that are in the back of, or even the front, honestly, the front of a lot of our minds, that they're asking these questions and they're not receiving the answers that they feel really give any clarity to the situation. A lot of it is wait and see, we're still researching, wait and see, we're still researching. And that doesn't really give you a lot of hope. I know it doesn't. It doesn't sound positive if we're constantly waiting and see. As I mentioned, how do you plan a future on wait and see? How do you plan a future on we're still trying to figure it out? You can't really plan as much as you probably could in the past because there's so much uncertainty around this pandemic, around this particular virus, around how our lives are going to keep going. We're basically on a 21-day period now, like where we only know as much as how much going to happen, as much as what's going to happen within the next 21 days, because that's the phase of reopening that we're in. Every 21 days, we're going to reconsider if we should move forward in our reopening phase or stay where we are. That we can only plan 21 days in advance. That doesn't sound like trying to recreate some semblance of normalcy in our lives. It's very limiting and it's difficult. And of course, this is only Canada's experience. There are other countries that are dealing with the pandemic differently or even similarly. There are a lot of us across the globe that are dealing with this, that are experiencing the same thing with our governments, where we're so unsure, and even the people that we're looking to for guidance are also unsure. And it really does create a sense of insecurity with a lot of us. Like, who are we supposed to trust? Who are we supposed to listen to? Who are we supposed to look to for guidance? How are we supposed to know how to move forward? Hold on to those questions, because when we return from our break, we're going to answer them. There is some hope. I told you guys at the beginning in the intro that I wasn't just going to leave you hanging with negativity, that there is a little silver lining, okay? There's still some hope and positivity that we can look towards, okay? So stay tuned and we'll be discussing that when we come back.
Yes, now me, your boy, Bishop, aka Bishop I Nolly, that worry boy. Yeah, so live and direct, and with the rock arm for Inside T-Dot Toronto. For the show, when we they call How Nasia. For GBKM TV and radio, where we they talk Kokori, Idemu they talk, and where we they use laugh, they make sense. This Obonga show will start for 10th of February for this year, we will do so. So enter the market for your phone, whether on Android or on iPhone, it no matter where they do. Whether on iPhone or Balende, China, or even at Toronto, it no matter. Just download the GBKM app so that me and you go feed the jollificate for this Obonga show. Ubi Mumu Chai!
Hello and welcome back to the Chat Up Show. I'm your host, Elizabeth Lloydie, and today we're discussing Pandemic Year 3, what's next? Now, before we went on the break, there were a lot of questions up in the air that haven't really been answered by our health officials, our governments even, that we haven't really received much clarity. But as I said, there is still hope. There is some silver lining. Now, Ontario's Chief Medical Officer of Health has a tone of optimism. He's a little optimistic. Nearly 2 weeks or 2 or 3 weeks after the province had instituted the modified lockdown that we're in to help slow the spread of COVID-19, the Omicron variant, Dr. Kieran Moore said, quote, "I'm starting to have much more hope." Listen, you guys know Dr. Moore is our homeboy over here. We always talk about him. He's always giving us the information that we need. And the fact that he has a little bit of hope regarding this pandemic and these new variants, I think that should give you guys enough hope as well at home. Now, he said the number of cases is decelerating instead of accelerating in terms of hospitalizations and ICUs as of last week. Now, Moore said the newest numbers he saw as of last week show a slight decrease in the total numbers of people in Ontario's ICUs. Even though we are seeing the pandemic high this week, he still does have hope that we will continue seeing the deceleration of cases as the weeks go by, and that he does feel positive about the restrictions that were put in place because he knows that that may have had an impact on what we're seeing in terms of the cases, that we will start seeing those numbers decrease, and that it is helping, that the sacrifices we're all making to ensure the safety of everyone and to ensure that our healthcare systems aren't completely overwhelmed do have consequences, and they are good consequences. Now, that, along with other indicators such as declining test positivity rates, provides him with some hope that the new restrictions the province instituted in early January are working. Now, he said, quote, "Our goal was to blunt the impact in these 2 weeks going forward, the weeks of the 17th and the 31st, and I think we're starting to see the effects." Now, the restrictions that started January 5th closed restaurants, gyms, and other businesses, limited gatherings to 5 people indoors and 10 people outdoors. Now, the province also shut schools down until Monday this week, but as you know, the snowstorm didn't allow kids to go back to school on Monday, but they returned on Tuesday for in-person learning. Now, Dr. Moore says the health system continues to be pushed to capacity with surging ICU rates and staffing shortages due to Omicron. He said, quote, "We didn't know when it would end, but I do think that the sacrifices Ontarians have made an impact and the amount of spread of the virus is slowing." Isn't that some good news ringing in your ears? See, it's not all doom and gloom. It's a little good news. It's a little good that what we are doing is making some form of an impact, scientifically speaking. You could back it up by science, right? Now, Moore did not say when the restrictions could be loosened because he says that that is ultimately the government's decision. Now, I'm sure you're wondering, when will the restrictions be loosened? Do not worry, I got an answer for you. Now, Premier Doug Ford, our shoveling king himself, is signaling restrictions imposed 2 weeks ago to slow the spread of COVID-19 super contagious Omicron variant that we know, and that will soon be eased. That these restrictions that we're under, we will soon ease out of them. Essentially, he said this 5 days after Dr. Moore had said that he doesn't know when we will come out of it. But now our premier is saying that restaurants, bars, gyms, theaters, and more could possibly start to be open. He said, quote, "We'll have some positive news. I believe we're going to make some announcements later this week about going back to other levels of restrictions," Premier Ford said. So there were no specifics provided during the interview that also, of course, included Dr. Moore. But Dr. Moore did say that he is continuing to have hope and that he is scheduled to hold his regular weekly news conference on Thursday afternoon. So there will be more updates coming tomorrow afternoon regarding when we could see these restrictions easing. But we heard it straight from Premier Doug Ford's mouth that we may start loosening up these restrictions, that we might still start seeing our hobbies coming back to life again, that we're able to go back to the gym and theaters and cinemas and restaurants again. Fingers crossed. He did caution, though, that last week's restrictions would gradually be relaxed in a 14-day increments to gauge the impact on infection levels. That it's not going to be a one day we're closed and then one day we're all open again. That it's going to take some phases and stages so that we're not overwhelming ourselves and then in turn overwhelming our healthcare units as well. So that it will be a 14-day gradual loosening of the restrictions, but at least there is hope that the restrictions will be loosened and that they weren't in vain, that they are contributing to some level of decrease in number of people in the ICU with a number of positive COVID test rates, which is how we have been gauging when we would go back into lockdown and when restrictions would be put in place, right? That if we had more than 10% of a positivity rate, then we would have to go back into restrictions. And when we did, I think we were almost at a 20% positivity rate, which was pretty high. And so that's why we went into this quote unquote pseudo lockdown that's not really being called a lockdown, but I mean, it basically is. Like, let's be honest about it, right? It basically is a lockdown. Now, Dr. Peter Juni, who's scientific director of the Science Table, that is advising Ford, said the government should not move too fast with reopenings, that it would be a mistake if the government would just reopen everything too quickly, that having the slow, gradual approach to reopening is the best option and safest option, that because hospitals are struggling with staffing. We talked about this earlier in the show about how there was funding that was allocated towards that, and that there was a promise made by our federal government that there would be at least 7,500 healthcare workers, professionals, that would be hired. That we're not seeing that right now, that our hospitals are still suffering with staff, and of course that there are COVID-19 drug shortages as well with treating COVID-19 patients, that there's not as much medicine available, that schools are just reopening to in-class learning as well. So we have to slow our reopening for other things, because first we have to see how how schools handle it, because we saw that schools started to become quite the hub for COVID-19 cases. I mean, there's only so much you could do within schools, and how kids are, interacting with their peers, and how teachers are interacting with students, and how that really makes up the learning environment, how COVID has impacted the learning environment as well. There were rapid test kits that were given to schools as well to help deal with the number of cases that were rising. But we did see that ultimately we were seeing a lot more cases happening when they were in person learning in school. So our government is being advised not to quickly reopen. So I say this, even though it is positive that we will probably be easing restrictions soon, that let's not get too excited that it's going to be 100% fully open like within 24 hours, that it's going to be phased out like we have been doing. We've been doing a phased reopening plan for a while now, that this is just a new phased reopening. Junie said, quote, "We need to be very careful," that he's predicting a prolonged plateau of hospitalizations from Omicron-fueled infections once a peak is reached, which is possibly going to happen this week before numbers start to go down. So what does that mean? It basically means that we're probably going to see a steady plateau in the number of cases, that we're not going to see the wave, that it's going to be steady, and then we're going to start seeing a dip in numbers of cases that are going to be happening if the government is slow and steady with the reopening, so that it doesn't completely bombard and overwhelm our health care units. Now, there are some other updates, which some people will see as a little positive, outside of the fact that we're going to be coming out of our restrictive pseudo lockdown. Another update includes the number of days that are required for isolation. Before, it was 10 to 14 days. Now, Ontario has changed the required isolation period based on growing evidence that generally healthy people with COVID-19 are more infectious in the 2 days before and the 3 days after symptoms develop. So within that 5-day period, the 2 days before the symptoms develop, so you catch it, 2 days before you start seeing the symptoms, and then the 3 days after you start seeing symptoms are the most infectious days. So those 5 days, which is why they've said, okay, those are the 5 most important days. If you isolate for those 5 days, we could probably be able to manage it, and then you will be, able to slowly come out of isolation. Now, this is for individuals with COVID-19 who are vaccinated, as well as children under 12. So this isn't they say this isn't really for those who are unvaccinated, that if you are unvaccinated, then you would probably be required to isolate for the 10 to 14 days either way. But for those who are generally healthy, that your symptoms may be a little milder, that you are able to, self-isolate and you can maintain your symptoms without having symptoms at home by yourself without having to go to the hospital, that you may just need to isolate for 5 days, because those are the most contagious days. The first 2 days before symptoms arrive and the 3 days after. Now, also, it says that those, your household contacts, so if you get COVID-19 and you live in a household with however many other people, those people that live in the house with you would also be required to isolate. That you are required to isolate together as well for those 5 days, because there is also the chance that, they could develop symptoms after. Who knows when any of you were infected, right? But just to make sure that none of you are gonna then go on and spread it around because one person in your home got COVID. That's how we saw it happen a lot of times, that people say, oh, it's only so-and-so in our household that has COVID. They're isolating, it's fine. I'm gonna go outside and do what I need to do. And then now we've spread it on to however other many people you've come in contact with. No, if one person in your household has COVID and you're all fully vaccinated and healthy and, the symptoms aren't that bad, then all of you have to stay isolated together. Now, individuals can end isolation after 5 days if their symptoms are improved for at least 24 hours. So that means no fever, you aren't sweating and feeling terrible and completely miserable for at least 24 hours. So you have to track that. And all public health and safety measures, such as masking and physical distancing, are followed. Now, non-household contacts are required to self-monitor for the full 10 days. That just, even though you don't live with someone, but you did, potentially come in contact with them, you do need to self-monitor your symptoms just to make sure that you aren't exhibiting symptoms as well. Of course, because you're not in close proximity, you may not be required to isolate. That is a personal choice. You may choose to do that anyway, but you won't be required to isolate because you're not within the household and you're a non-household contact. So the chances of you catching it, because your time with that person is probably limited, as opposed to someone who lives, eats, sleeps, drinks, in the same household as someone who has COVID. It's a different level of exposure. Now, individuals who I mentioned I mentioned individuals who are unvaccinated or partially vaccinated or immunocompromised will still be required to isolate for the 10 to even 14 days if that makes you feel more comfortable. Now, while individuals who work or live in high-risk healthcare settings are recommended to return to work after 10 days from their last exposure or symptom onset, or from their date of diagnosis, so 10 days after either the date of diagnosis, the last time you noticed the symptom, or your last exposure to someone who was positive, you still have to wait 10 days after that. Just to ensure sufficient staffing levels, workers will have the opportunity to return to work after isolating for 7 days with a negative PCR or rapid antigen test result, which will be provided by the province through the healthcare setting. So if you are working within that system and before you were isolating for the 10 days, now it's 7 days with the negative test results that are provided by the province. Now, this is, of course, in response to the uniquely high-risk nature of long-term care settings for Ontario's most vulnerable individuals. Remember, throughout this whole pandemic, they were the first, that we were working towards to ensure that they were taken care of. When it came to vaccines, they were the first to receive their vaccinations, even the booster shots as well. That the people, they're probably the most vulnerable in our community, and it's where a lot of COVID cases were spreading quickly because staff probably short-staffed, number one, that there wasn't enough staff to go around to help manage the growth or spread of the virus rather, and so then that means like less staff are working with a lot of patients at the same time, which then exposes them, of course, to the virus even more. So this is a way to, help with dealing with that if people aren't having to quarantine or self-isolate for the full 10 days, then they're missing less work. And then there's less strain on those who are left at work in terms of staffing issues. So this is what our provincial government is hoping will help deal and combat with that issue. That, when people are isolating, you don't want it to put a strain on the workforce that are left working, that you want to make sure that there's a good enough turnover that, these workplaces can function and that they can do what they need to do. They can do their jobs and they can do their jobs safely and they can stay healthy with it as well. Now, the province is also mandating third doses for all staff, students, volunteers, caregivers, and support workers by January 28th of this year. Now, for those currently eligible for a booster and will be requiring visitors to provide proof of a booster dose once the temporary pause on general visitors is lifted. Of course, right now we are in our pseudo lockdown, so that has been put in place. But once that's lifted, if you are, hoping to visit a long-term care facility or one of these healthcare systems, this is what you will have to be prepared to deal with as of January 28th. That we haven't gotten to a point yet where, we're claiming that folks with the booster shots, are the only fully vaccinated people, but we're slowly starting to see that come into play. I mean, if this is the first step, how long will it take before now everyone is required to show proof of a booster vaccine when, we're going to the restaurants or to the cinemas like we were before? So this is just what our government's doing right now, just to help deal with our most vulnerable in our community. And this could also be potentially what we will see in the future as time progresses. Now, as I mentioned before, 14 days, we're going to see we have the reopening of lifting these new restrictions that were put in place over a 14-day period, that it's probably going to be a slow rollout. Of course, Premier Ford and Dr. Kieran Moore will be doing their weekly press and news conferences as well to give a lot more information as to how that will be happening. And we will always keep you updated right here on the Chat Up Show as to what's going to happen with that. Everybody wants to know when they can go back to socializing the way we were before. I know, I get it, we missed it. Like New Year's Eve, Christmas wasn't the same this year, wasn't the same last year. So we're trying to play catch up now. So as soon as we can, we want to get up outside and be out in the streets, maybe not in the snowy streets, but you know what I mean, figuratively speaking. Now, to also help with the number of rising cases, the Provincial Antigen Screening Program, or the PASP, P-A-S-P, provides free rapid antigen test kits to high-risk communities, organizations, and workplaces so that they can, test folks who have to be on site, who have to physically be working, who have to be there in person, and to ensure, folks aren't coming to work sick and having to work sick. That, this is a way we can deal with the situation. We know that COVID can spread in workplaces rather easily. We try as much as we can to wear our masks as much as possible, but then when you're eating, sometimes you may forget and you start a conversation with a coworker, and next thing you know, COVID. Or, when you're working and next, you maybe wiped some sweat off your forehead, I don't know, and something gets mixed up somewhere. Like it can happen. COVID can spread. Even though you do take the precautions, we are humans. Sometimes we forget, we make mistakes. It can still continue to spread. So this is another way that the government is providing the resources for organizations and workplaces to help manage that and to get on top of it. That if you provide free test kits to folks who are asymptomatic or anything, you do the screening. Of course, checking for temperatures is still a common practice in a lot of places and a lot of workplaces. And then on top of that, having this test available as well will just be another added layer of defense. Now, the program is available to all organizations that are allowed to be open under current public health measures. Of course, if you're not allowed to or supposed to, you probably won't be eligible and you won't be able to, because you have to apply for these test kits, of course, so you probably won't be accepted. And it also requires people to be physically present on site. So this is the criteria. Any organization mandated to test through a provincial vaccine policy like Directive 6, which essentially